COPD stands for chronic obstructive pulmonary disease. It most commonly affects smokers because smoking usually plays a significant role in its development.
It essentially is that your lung remodels itself. The lung architecture changes based on mostly smoking, which changes the way that air is emptied from the lungs. And when air comes out normally, it comes out nice and linear and nice flow. When people have chronic obstructive pulmonary disease, the air that comes out is a little bit obstructed. It has a more difficult time to get the air out. And people who have COPD for a long time, their lung actually changes architecture. Their lungs actually start to look different.
Normal lungs look pink and rubbery on the outside and spongy on the inside. Within each lung are tree branch-like structures called bronchi. At the end of these branches are little grape-like bunches of alveoli, or air sacs. It's these structures that are damaged by COPD.
They change because the actual airways become boggy. They actually get a little bit spongy and have mucus that lines them so that air has more difficult time getting out. And when you have COPD for a long period of time, those grapes at the end, they lose their elasticity. They usually, you can squeeze them and they pop right back. But after a while, the rubber band-like activity of the little sacs, they degrade and those sacs become floppy. So air actually gets trapped in the alveoli, in those grape sacs. And when a person with COPD tries to breathe out, they can't as easily because air is obstructed in the main airways, but it's also trapped in the grape-like structures at the end. So over time, those two things make people have a difficult time breathing because the air can't get out of their lungs.
In addition to difficulties breathing, patients experience wheezing, chest tightness, chronic cough, and recurrent illnesses like colds, flus, asthma, and bronchitis. We think that about half of Americans with COPD go undiagnosed. They don't realize they have it. They often think that they're just getting older, or that they're out of shape, or that their symptoms are the normal side effects of long-term smoking, and that's why they're struggling to catch their breath. All those things could be true, but as long as the COPD goes undiagnosed and the smoking continues, the lung function will continue to deteriorate.
Over time, as you age, everybody loses lung function. It's normal. But most people are on a very gentle slope, that their lungs lose elasticity and lose strength over time. So there's a very gentle slope of lung activity that's lost. Smokers lose lung activity quicker. They are on a steeper slope. When you stop smoking, you can't go back up the hill, but you can get off the steep slope and you can get back onto the gentle slope. So that's really the goal of stopping smoking, is to get you off that steep slope.
If you're a smoker and haven't yet experienced any negative side effects, ask your doctor about smoking cessation plans and programs. Quitting isn't easy, but with the right help and guidance, it can be done. Getting back on that gentle slope before COPD becomes a lifelong struggle will be worth the effort. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.